Definition: gastroesophageal reflux disease (GERD) is a chronic digestive disease. GERD occurs when stomach acid or, occasionally, stomach content flows back into your food pipe esophagus. The backwash reflux irritates the lining of your esophagus and causes GERD. Please like, share, comment and subscribe. Thank you. Both acid reflux and heartburn are common digestive conditions that many people experience from time to time. When these signs and symptoms occur at least twice each week or interfere with your daily life, or when your doctor can see damage to your esophagus, you may be diagnosed with GERD. Most people can manage the discomfort of GERD with lifestyle changes and over-the-counter medications. But some people with GERD may need stronger medications, or even surgery, to reduce symptoms. Symptoms: GERD signs and symptoms include a burning sensation in your chest, heartburn, sometimes spreading to your throat, along with a sour taste in your mouth, chest pain, difficulty swallowing, dysphagia, dry cough, hoarseness or sore throat, regurgitation of food or sour liquid, acid reflux, sensation of a lump in your throat. When to see a doctor: seek immediate medical attention if you experience chest pain, especially if you have other signs and symptoms, such as shortness of breath or jaw or arm pain. These may be signs and symptoms of a heart attack. Make an appointment with your doctor if you experience severe or frequent GERD symptoms. If you take over-the-counter medications for heartburn more than twice a week, see your doctor. Causes: GERD is caused by frequent acid reflux, the backup of stomach acid or bile into the esophagus. When you swallow, the lower esophageal sphincter, a circular band of muscle around the bottom part of your esophagus, relaxes to allow food and liquid to flow down into your stomach. Then it closes again. However, if this valve relaxes abnormally or weakens, stomach acid can flow back up into your esophagus, causing frequent heartburn. Sometimes this can disrupt your daily life. This constant backwash of acid can irritate the lining of your esophagus, causing it to become inflamed, esophagitis. Over time, the inflammation can wear away the esophageal lining, causing complications such as bleeding, esophageal narrowing or Barrett's esophagus, a precancerous condition. Risk factors: conditions that can increase your risk of GERD include obesity, bulging of top of stomach up into the diaphragm, hiatal hernia, pregnancy, smoking, dry mouth, asthma, diabetes, delayed stomach emptying, connective tissue disorders, such as scleroderma. Complications: over time, chronic inflammation in your esophagus can lead to complications, including narrowing of the esophagus, esophageal stricture. Damage to cells in the lower esophagus from acid exposure leads to formation of scar tissue. The scar tissue narrows the food pathway, causing difficulty swallowing. An open sore in the esophagus, esophageal ulcer. Stomach acid can severely erode tissues in the esophagus, causing an open sore to form. The esophageal ulcer may bleed, cause pain and make swallowing difficult. Precancerous changes to the esophagus, Barrett's esophagus. In Barrett's esophagus, the tissue lining the lower esophagus changes. These changes are associated with an increased risk of esophageal cancer. The risk of cancer is low, but your doctor will likely recommend regular endoscopy exams to look for early warning signs of esophageal cancer. Treatments and drugs: treatment for heartburn and other signs and symptoms of GERD usually begins with over-the-counter medications that control acid. If you don't experience relief within a few weeks, your doctor may recommend other treatments, including medications and surgery. Initial treatments to control heartburn: over-the-counter treatments that may help control heartburn include antacids that neutralize stomach acid. Antacids, such as Maalox, Mylanta, Gelicil, Gaviscon, Rolaids and Tums, may provide quick relief. But antacids alone won't heal an inflamed esophagus damaged by stomach acid. Overuse of some antacids can cause side effects, such as diarrhea or constipation. Medications to reduce acid production. Called H2 receptor blockers, these medications include cimetidine, Tagamet HB, famotidine, Pepcid AC, nizatidine, Axid-R, or ranitidine, Zantac. H2 receptor blockers don't act as quickly as antacids do, but they provide longer relief and may decrease acid production from the stomach for up to 12 hours. Stronger versions of these medications are available in prescription form. Medications that block acid production and heal the esophagus. Proton pump inhibitors are stronger blockers of acid production than are H2 receptor blockers and allow time for damaged esophageal tissue to heal. Over-the-counter proton pump inhibitors include lansoprazole, Prevacid 24HR, and omeprazole, Prilosec, Zigarid OTC. Contact your doctor if you need to take these medications for longer than 2 to 3 weeks or your symptoms are not relieved. Prescription-strength medications. If heartburn persists despite initial approaches, your doctor may recommend prescription-strength medications, such as prescription-strength H2 receptor blockers. These include prescription-strength cimetidine, Tagamet, famotidine, Pepcid, nizatidine, Axid, and ranitidine, Zantac. Prescription-strength proton pump inhibitors. Prescription-strength proton pump inhibitors include esomeprazole, Nexium, lansoprazole, Prevacid, omeprazole, Prilosec, Zigarid, pantoprazole, Protonix, ribeprazole, Asofex, and dexlansoprazole, Dexilant. These medications are generally well tolerated, but long-term use may be associated with a slight increase in risk of bone fracture and vitamin B12 deficiency. Medications to strengthen the lower esophageal sphincter. Baclofen may decrease the frequency of relaxations of the lower esophageal sphincter and therefore decrease gastroesophageal reflux. It has less of an effect than do proton pump inhibitors, but it might be used in severe reflux disease. Baclofen can be associated with significant side effects, most commonly fatigue or confusion. GERD medications are sometimes combined to increase effectiveness. Surgery and other procedures used if medications don't help. Most GERD can be controlled through medications. In situations where medications aren't helpful or you wish to avoid long-term medication use, your doctor may recommend more invasive procedures, such as surgery to reinforce the lower esophageal sphincter, Nissen fundoplication. This surgery involves tightening the lower esophageal sphincter to prevent reflux by wrapping the very top of the stomach around the outside of the lower esophagus. Surgeons usually perform this surgery laparoscopically. In laparoscopic surgery, the surgeon makes 3 or 4 small incisions in the abdomen and inserts instruments, including a flexible tube with a tiny camera, through the incisions.